Hi, and welcome to St. Joe's Mercy Oakland. My name is Ansley. I'm one of the nursing education coordinators here at St. Joe's Oakland, and I'd like to start by welcoming you all to your new career here. We'd like to just start with a little introduction um, and go over the fact that we'd like everybody to start punching in and out on the time clock. The closest ones are generally by the Pavilion elevators, which is just down from Java Joe's. If you happen to punch in today, that was great, and please make sure that you punch out tonight. But if you did not punch in yet, you will go ahead and make sure that starting tomorrow that you punch in and out at the beginning and the end of each day you're here. If for some reason you miss a punch, you are always able to go use the edit book that you can find on your unit. Each unit has their own, and you'll be able to fill that in. During class, we want to make sure that you are silencing your pagers. Not that any of you probably have pagers anymore, but in case some of you are back in the 1990s, please silence your pagers and make sure that you have your cell phones on vibrate. If you do have an urgent situation that you need to take a call, we ask that you do step outside as not to disturb everyone else or the speakers that you will hear over the next couple days. So, our nursing mission statement: we serve together in Trinity Health in the spirit of the gospel to heal body, mind, and spirit, to improve the health of our communities, and to steward the resources entrusted to us. We do all try to live our mission every single day here at St. Joe's Oakland, and you'll find that as you meet your new family on your unit, that it is a cohesive group, that we all work well together. So let's go through a few things that we've given you. You should have all received a packet. Inside the packet, you will find that you have several checkoffs in there: Inova Biomed, a donning and doffing sheet, a rehabilitation checkoff sheet, and a restraints checkoff. If you'll make sure that on each of those that you write your name, today's date, and your unit on all of those. Also on the Nova Biomed, it also asks for your ID number. So please make sure that you enter in your employee ID number. If you're not sure what that is, it can be found on the back of your badge. After you have written your name and all the information on the front of the sheet, please make sure that you flip the sheet over and sign where it says associate signature. You also have been given a critical pathway, some badge buddies, nurses and nurse externs. You also have a pocket guide. Um, and then last, we're also going to talk about when you are going to do your EPIC training and for BLS classes. So let's start here. How to get some of your orientation materials. So there are some materials that we have not given you. We decided that not everybody needs to kill a tree when in orientation. So a lot of the materials we put on our nursing education webpage, so that way you can get the information you need that way. So there's two different ways that you can get to the nursing webpage. One is from our ZenWorks page, which is your main um, application page that you will have on each hospital computer. You can find the St. Joe's Nursing webpage, and you can see here it's circled in yellow. Once you get to that, you will select clinical resources and then select orientation. The other way that you can find that is if you go into our intranet page, which will take you to our Mercy Health plus St. Joe's regional page. Select the Oakland, and then from here you'll use the drop down to select departments and nursing education. And then once you're there, you would then again select clinical resources and orientation. So from our nursing webpage, you can see here under knowledge and innovation technology, we have our clinical resources. And then down here, you have the orientation folder. Inside the orientation folder, you will find lots of little tidbits that you can go through and review. Um, some of the highlights, we just grabbed a few, is our B4 band, our blue blood bank bands, antibiotic stewardship information, our skin bundle, controlled substance waste disposal guide, a pocket guide for pain management and comfort options, our St. Joe's Fall program, well, preventing them anyways. You also have been given a critical pathways. So both our nurse externs and our RNs have critical pathway. This critical pathway is kind of your journey through orientation for you and your preceptor to fill out. It is imperative that you go through and fill this out with your preceptor as you're going through orientation. Upon the completion of your orientation, it needs to be filled out and then turned into your manager. One of the things that needs to be completed in that is, I believe it's on page 4, could be 3 or 4, is there is a policy lookup. So all of these policies, we expect you to go into Policy Manager and read those and just simply put the date that you read each of those as you complete those. Here are some badge buddies that you may have received. Our radial stasis band, hypoglycemic protocols, I's and O's, our T, vital sign parameters, our 1-hour bundle for sepsis. Next, we're going to talk about the RN Pocket Guide. We also are giving these to the nurse externs. There's a lot of information in there we feel can be useful for you to have at your fingertips. Our suggestion is that you keep it close. That way you can utilize the information in it whenever needed. Things that you will find in there is our current 2021 Hospital National Patient Safety Goals. Approved abbreviations, stroke core measures, as well as core measures for influenza or immunizations and for VTEs, fall documentation checklist, our BMAT information, hypoglycemic guidelines, our CWA protocol, universal timeout, our HAPI prevention and skin bundle information, Lyme's do's and don'ts, CLABSI prevention, CAUTI prevention. Oops, sorry. CAUTI prevention, including our nurse-driven Foley removal protocol. Yes, you as a nurse are able to make those decisions. Our 1-hour bundle for surviving sepsis. And we have information regarding safe patient room, considerations for behavioral health, and care for patient with suicidal ideation. Virtual monitoring, we use a system called Avasure here. You'll learn a little bit about that later. Information is here that you can use when ordering that. We also have Posey beds that you're able to order to help keep your patient safe. And then we have information about nonviolent and violent restraints. Sorry about that. For our C-Diff screening tool, information on that, our MRI screening tool, oxygen delivery, order of draw for labs, a resources page, escalation protocol, more controlled substance waste guide. And here you'll notice some more reference information for you, including for our new Plum 360 IV pumps. There is priming, our basic programming and advanced programming QR codes. You can scan those with your phones to get information on those. Information also on our lifts. We have some QR codes that you're able to go through and use as references. Other resources you have available to Healthy Library, Lippincott Procedures, Lexicomp, Lippincott Advisor, Neofax, Also, you've got here's the policy manager, safety data sheets, and our TH work related um, reporting system, which you will learn more about. This is if you have an employee injury. You'll notice on the very back page of your pocket guide, it has some quick numbers for you to call for different areas, also some paging. Our emergency number in-house is 222, and our big one, if you ever need to call in, you do need to call in to our clinical house supervisor, and here's their direct number to do that. And that's 248-858-3672. And again, just as a quick FYI, you will not call into your unit and talk to your manager. You will call into the clinical house supervisor as they staff the entire building, not just your floor. All right, so when will you take your EPIC classes? For mental health techs and our PSTs, on Wednesday of your orientation week at 8 o'clock, you will take your EPIC class. And for our nurses, GNs, nurse externs, for if you work in the med surge area, critical care, behavioral health, or NICU, you will take your class Thursday at 8 o'clock. If you work in a specialty area, it will depend on your unit specific when you will take your class. Brittany will get with you and do that for labor delivery, mother, baby. You will talk to Susan or Michelle, and they will let you know. Just so you know that you have been all assigned EPIC modules in your health stream. You will need to complete those as soon as possible. You will also be given an EPIC checklist that you and your preceptor will complete. Both the modules and the checklist need to be completed as soon as possible. You may not be given access to EPIC until they're both complete. So you want to make sure you get those done sooner than later. All right, dress code. What should you be wearing? Business casual or scrubs are appropriate for this week. Always, you should have your identification badge. It should be between your chin and your waist. Lanyards are appropriate, but they do need to be breakaways. And if you lose your badge, please make sure that you report that to security. Colleagues that are assigned an RTLS badge, which is this guy right here, they also need to keep that on at all times. These RTLS badges are pretty cool. You'll learn a little bit more about that in technology, but this gives the ability when you walk into a room, it recognizes that you have entered. And so if your patient had their call light on, as soon as you walk into the room, it will turn the call light off. It also helps with like our hourly rounding. We are able to track how long it's been since someone's been in the room. If it's been about an hour since any employee has been in the room, a pink light goes on. So we use these for a lot of different things. There's also a distress button that you're able to use on here if need be. Personal electronic devices, including headphones, should not be visible and off unless you're in an off-stage area. So if you're in the break room, cafeteria, locker room, it's appropriate to have those, but you should not have those out when you're in front of patients. We are a fragrance-free environment. Any perfumes or colognes are not permitted. There's a lot of individuals that work here and patients that are sensitive to smells. Clothing that you wear on your shift should be clean and free of tobacco. If you have any questions, you can always refer to your uniform guidelines, which is a policy. When you come for in-services, you should also be dressed appropriately, just like this week, either your scrubs or business casual. And please make sure that you are maintaining your own personal hygiene. Just a quick review, nurses are going to wear royal blue. Our PCAs, PSTs, and sitters wear kind of that teal green. Nurse externs wear a forest green. Our HUCs or unit health unit coordinators wear a maroon or a burgundy. Dietary usually wears it's black. Some of them have some red on it, some maybe a smock. I can't remember at this moment. Respiratory folks, they wear navy bottoms and teal tops. Our transporters, our lab techs, and our pharmacy techs all wear navy blue. And the way you can tell them apart is what they're pushing. So if they're pushing a patient or a bed, they're working transport. If they have a little cart that has blood drawing supplies on it, they work in lab. If they're pushing medications around, they're a pharmacy tech. Next, our housekeeping friends wear usually, I believe it's a gray top with black bottoms. Our supply chain friends wear, most of them wear a black polo and black pants. If you see any of our volunteers, they have either a red smock or a red vest, pink vest, or pink blouse on. And our friends that work in PMD wear a seal blue top and bottom. So this is Kronos. This is where you're able to punch in and out every day. So if you did not punch in yet, you will punch in tomorrow. This is the time clock, and your time card will go. Oops, sorry about that. Will go in along this side. You want to make sure that when you use your badge, that your face is facing you, and then you just slide that end right down the side. And just again, make sure that if you do miss any punch, you can fill out your edit book on your unit. We do have several committees that you have the option of joining to be a part of. Our PNC, which is our Professional Nurse Council, we have unit-based councils, different leadership meetings, technology committees, infectious disease committees. We also have a nurse residency program. It also has a board, which we ask for volunteers for. We also have volunteers for our Stork's Nest, a fun committee, and our Pontiac Time Bank. Voice. This is our reporting system for improvement. So if we don't know things that go wrong, we don't have the opportunity to improve them. So things that you find, we ask that you fill out a voice report. There are some things that are required to be filled out for, and others that are not required, but we would encourage. So how do you find your voice report? From the hospital intranet, sorry, you can find that you have a quick link located there. Also on your ZenWorks page, you'll see the RL Solutions voice, and that is what the application looks like. Once you open that application, it gives you the option of signing in as yourself or signing in anonymously. Either one will work. And then it asks you, what are you reporting? So just real quick here, you can see there is one for falls. Any fall of a patient that happens is required to be filled out. Medication event, we ask that you fill out one for all near misses and actual medication errors that have occurred. The reason why, again, this is a way for us to track. So for example, for the medication, if you gave a whole pill when the order actually said, to give half of a tab, that is a med error. If you fill this out, we're able to track, were you the only one that happened to, or has it happened to other people? If everyone is able to go through and fill out when they have that error, then we're able to track, well, look, we had 10 people in the last, 2 months that have accidentally given a whole pill instead of a half a pill. So we realize that this is probably a dispensing error or the way that the order is written. So then we can go back to look to see what can we do to improve this to stop this from happening since it's happened more than once. And as you go through to fill out your voice report, it just will ask you different questions. So other things that can be on here, you can have witnessed an altercation. You can notice that maybe someone didn't necessarily, um, wash their hands every time they went in and out of a room, other various things. Anything that you feel that needs to be communicated, that you don't feel comfortable necessarily communicating to your manager, you can put in a voice report. All right. So next, let's talk a little bit about how things get lost in translation. Different communication styles. Not everybody always communicates in the same manner. We work in an environment where there is a high level of activities with lots and lots of interruptions. And if we don't have a standard way of organizing all the essential information, it tends to get lost and important things are missed. So, what is good communication? Part of that is calling the right person the first time. And then you're able to express your specific details of the situation and ask for what you need. You want to make sure that you're being factual and you always want to communicate professionally. So, some of the communication tools that we are able to use here are we use Cuss, we use Huddle, SBAR, and handoff communication. So, cuss. Yes, you get to cuss at work. I am concerned. I am uncomfortable. This is a safety issue. Cuss is a secondary layer that helps us recognize that people are saying something that we really need to hear. And it's a way to make sure that that information isn't just lost. When we're very busy passing medications and trying to call the doctor, and then we have a family member coming up to talk to us, meanwhile, you have a PST that comes up to you and says, Mr. Jones's blood pressure is 188 over 200 or over 100. And you know, you kind of heard that they said something, but you can't really. But I'm concerned with Mr. Jones's blood pressure. It's very high, and then give you the numbers. So I'm concerned or I'm uncomfortable with how high his blood pressure is. Those words are supposed to help cue you to listen. So for our PSTs, we expect you to communicate with using those cuss words, telling I'm concerned, I am uncomfortable. This is a safety issue. That way, when you start with that, people will listen. Same thing with our nurses. We want you to use those same words when you're talking to your manager, to your charge nurse, to the doctors. So that way we're able to use those words and people know, oh, I have to listen. I need to take a moment and listen. Chain of command, line of authority of who do you go to next when your communication um, is not working where you're at and you need to move it up. Knowing that most of the time things can be resolved on your unit, going to your charge nurse, going to your clinical lead, going to your manager, um, and clinical house supervisor is always a good resource for you. Quite oftentimes, our nurses that work in logistics also can help you with a lot of things. Most of them are very experienced nurses and are able to help with some of that chain of command. Um, you know, when you have a resident covering, sometimes you need to call their senior or the attending. And so we'll go into a little bit more of that chain of command and escalation protocol. And if you'll recall that there is a section on that in your pocket guide. And it looks just like this escalation. So when you're trying to move things up, you have to determine is that patient and purple patient or an orange patient. So that is based on coverage that we have. So for patients that are purple, that means that there's a nurse practitioner or a PA that covers for that physician. If they're in orange, that means that it is a resident, or it could be that it's just the attending that does their own coverage. So you always, you have to figure out who is covering, and you can do that by hovering over the treatment team in Epic, and then you're able to then page, and if need be, page the senior resident or the attending. And again, clinical leaders, nurse managers, clinical house supervisors are great resources to you. We also are very big on handoff communication. So when should you communicate? Anytime you have an admission, discharge, transfer the patient from one unit to another, and transfer to the patient for care responsibilities. So that means if it's a shift change or if they're going to a testing area, even if you're going on a break, depending on what's happening, with that, you need to make sure that you're giving good information. That includes good handoff communication to people working with you. So if you have someone covering for you, they should know. If you have PST or a sitter, they should be getting a good communication as well. So everyone's on the same page. Bedside shift report. So bedside shift report is very important. It starts building a rapport with the patient. You're able to learn a little bit about the patient, and they're able to meet their oncoming nurse. It's a great time to be able to go through any high alert um, identification, things that need to be done if they have a high alert med. Make sure that all your handoff assessments are correct. If you need to do a 4-eyes, if you're in ICU. It also is evidence-based for best practice and allows more accurate reporting. We also have virtual reporting for any ER um, transfers, and I believe transfers that are coming like from surgery from PACU, I believe also are doing virtual reports. And you're going to learn a little bit more about that on Wednesday. Purposeful rounding. So purposeful rounding is a time that you can take to make sure that we are meeting all of your patients' needs. If you're not meeting your patients' needs, they're constantly trying to get up or they're on the light. And so that, is taking extra time from you and having to go and answer the light, as well as perhaps other staff members if they keep trying to get up because we haven't met their needs, whether they're trying to go to the bathroom or they're trying to get something from the closet. Again, that puts them at risk. It also takes more of your time. If we're doing purposeful rounding, and we're doing that about every hour or so, and we're going in to make sure that the patient is in a good position and they've been to the bathroom and they're not in any pain and they have everything that they need, then we're making sure that they don't use the call light and they don't have to get up until we return in that hour. And then they know that we're going to come back and then we're going to, be able to take care of whatever their needs are. If they're feel confident that you're going to come back and check on them frequently and take care of all their needs, they are less likely to get up and they are less likely to be using the call light. So just a few key words, do you need to use the bathroom? Well, I'm here. Hi, I'm here to check on you. Are you having any pain? Someone will be back in about an hour to check on you again. Can you reach everything you need? Is there anything else I can do for you? I have the time. And are you comfortable in that position? So we're addressing all kinds of different things here while we're doing this purposeful rounding. Purposeful rounding does not mean that we've walked in, we've looked at the patient and said, "You okay?" It's a lot more than that, as you can see. Verbal orders, we don't do them. Verbal orders, you know, physicians, if you are face to face with a physician, he or she should be able to go through into that computer that's right there and put in that order. They also have the ability to use different applications for Epic from their phone and from a tablet. So most providers are able to go through and put in their own orders. Now there may be times that, you might have to do a telephone order if they're, maybe don't have good connection or they're driving. So if it's not possible for them to put in the orders, you could do a telephone order. Again, you would want them to stay on the line and until you want to make sure that you're reading back the order and have them stay on the line and actually until you've signed it to make sure that there's no pop-ups near the end, because the worst thing you can do is you get the order, you think you've got it all written down correctly, and you read it back, they're like, yeah, that's right, and then you put the order in and it says, oh, but wait, it's contraindicated because of X, Y, and Z, and then you have to call them back, and they don't they don't like that very much. So just ask them to patiently stay on the line. Few resources you can see over here. This is our regional page. You have your Oakland here. You have some quick buttons like to the voice, HealthStream, our library services. This is our ZenWorks page. We have things that you can get to, like our Healthy Library, HealthStream. For Healthy Library, we have up-to-date information, Lippincott Advisor, Lippincott Procedures, LexiComp. These are, you have access to them while you're here at the hospital. Utilize them. They can be a huge help to you. All right, that is all I have for our intro. Again, welcome. Thank you all very much. I hope to see you soon.